More than 100,000 people across the South Plains could soon lose in-network care at Covenant Health. The hospital reports a stalemate in its negotiations with insurance provider Blue Cross Blue Shield after a 7-month effort to provide affordable care to patients in our area. KCBD News Channel 11's Madeline Hall joins us with a closer look at what this means. Madeline.
Brittany, the disagreement between Covenant Health and Blue Cross Blue Shield boils down to money, and it's not an unusual negotiation. In fact, Covenant reports it's something Blue Cross has done 7 times with different health systems across the state this year. The problem in this case lies in the lack of response.
Today is day 13 that we have not had a response from Blue Cross.
A 7-month negotiation coming down to the wire. Covenant Health and insurance provider Blue Cross Blue Shield have just 1 week to reach an agreement, or the hospital will no longer be considered in-network.
The number one question that people are going to say or ask is Covenant being greedy? Like, is this because Covenant is being greedy and, and is walking away from the table, in a fashion? And the answer is no.
Covenant Health reports the negotiations began in December when the hospital system asked Blue Cross to increase its reimbursement for what it describes as vital healthcare services.
These are rates that when we look nationally and in the state, we feel like are fair reimbursement. And just to give an example of that, like the most concrete way that I can say this is, if I negotiate a better deal with Blue Cross Blue Shield, not one person in this entity makes any more money.
Covenant, a not-for-profit healthcare system, reports a 10% increase in staffing costs, 7% increase in pharmaceutical costs, and a nearly 15% increase in the cost of medical supplies, all since 2022.
So that is part of the problem that we're trying to solve here, is that as all of our costs go up, so concomitantly does the reimbursement, has to stay in touch with that.
Blue Cross Blue Shield, the biggest insurance provider in the state, currently covers more than 140,000 patients across 20 area counties. In a statement, the company tells us it understands the cost pressures hospitals are facing, but must also protect the interests of its members and customers who are facing similar pressures.
The premiums for patients covered by Blue Cross 3 years have gone up 23%. So they're charging the patient and companies more to have the coverage. There just has to be, and I understand why, their costs are going up as well, but that's where we just have to also be at that table to make sure that we can cover our costs to take care of patients.
Again, both Covenant and Blue Cross Blue Shield tell us they are committed to reaching an agreement, but they must reach one by July 31st or the changes will go into effect August 1st. Covenant urges you not to change your doctor in the meantime. It has a hotline and an FAQ sheet set up for any patients with questions or concerns. You can find those resources at kcbd.com.